Hey everyone, I thought I'd come on here and say where I've been. First off, I was trying to record videos and I have an issue with my phone right now. So all those videos that I was going to record, well, I started to, those got messed up, and that was like a few weeks ago. Um, so I thought I'd just do a check-in. So a couple weeks ago, since I was last on here, I had a severe heat exposure experience in a patient's room, and it was like close, it was like 100 degrees or something, and I got really ill for like a week after being in that heat. So I know better, but that's just, sometimes things happen like that. Like I just got, my veins, were sticking out of my hand, and I got really sick because the last thing I have left is like the pots with the endothelial damage. So that is better now. And I noticed too, when that happens with the heat, that I'm really prone to I have a lot of stressful things going in my life right now. So it kind of, the symptoms kind of act up a bit they were kind of bad for like a week there, but they're a lot better now. I haven't even I haven't even taken a propanolol at all, or really had to. Sitting down, my heart rate's been at like a 75. And then standing, it's been like a 90, 95. Unless I take a shower, then it's way over. It's like 120 when I stand for like a good hour. Because we all know that hot showers are not what you're supposed to do when you have vein issues like I have, or POTS. But sometimes you just need it for your muscles, something, a really, really hot shower. So I saw some comments on doctor's list for Incelldx. So if you're a patient and you've met with Incelldx, they will get you, if you message them, they will get you a list of doctors in your area. Because I saw that comment below. And someone asked me where I got the blood test. Again, was Incelldx. Let's see. So since I last was on here, which was quite a few weeks ago, I tried naltrexone at 1.5 milligrams. Horrible, horrible, horrible. My feet were on fire. Trying to lay down, my feet were bright red. I was flushing. I had a fever. I got really, really sick from that. So yeah, I can't imagine like the people that are getting off opiates and have to take that at 50 milligrams to 100 milligrams, how they deal, because I could not deal at 1.5 milligrams. It was so awful. Like I was having extreme anxiety, which I know what happens on a lot of drugs that I take. It will cause anxiety. I normally don't have anxiety, even though my heart rate goes up. I don't have anxiety that much. I don't really worry too much, or at least I try to. I worry before I take a pill because I know I have many, many side effects to when I try new medications, or even like, I think it's the mast cell. I'm pretty sure it is because, like I can't eat high histamine foods, and I'm sure I have mast cell disorder. Which I'm meeting an allergist next month. That's really good. So we will have a confirmation probably on that by the end of December. But if anyone has tried fluvoxamine, let me know. I'm going to start my fluvoxamine prescription this Friday. I'm kind of scared because I see that anxiety is a side effect and insomnia, and every medication gives me that. So if anyone has tried fluvoxamine, let me know, because I'm going to give that a try. Hopefully it'll work and not make things worse. But if it does, at least I know like in a couple days, it'll be out of my system and I'll be okay. I mean, I'm used to medications not working for me. Really, the only drug that didn't cause me bad side effects was Incelldx, the Maraviroc, and let's see, propanolol in very small doses. That is it. Everything other than like I take a Pepcid sometimes for histamine problems, that's fine. I can't even take an H1 blocker, antihistamine, because my heart rate goes up. So everything makes my heart rate go up. So I just have to be very careful when I take things. But other than that, like, I'm just trying to think about my symptoms lately. I am going to school full time finishing that up in this last year. I don't know how, since I've had long COVID, I've been able to maintain A's, straight A's. I don't know how that's been because at the very beginning, I had horrible brain fog. I don't really have that now unless my heart rate goes up extremely high, but I don't really have brain fog anymore. Let's think. Yeah, like I'm doing that. I'm doing my clinical. So right now I'm finishing up in the next between May and June, my clinical, and then I'll be graduating. So I've been able to do that at like 20 some hours a week. Let's go to school full time. I'm surprised. I think it's because I'm not standing. Like if I had a job right now where I was standing probably more than 5 hours, I probably wouldn't be very good at first, but because I've tried that. If I stand in one place for too long or move my arms, I remember it would be way too much for my poor body. And I don't know if it's because I'm deconditioned or because of the POTS. I am not sure. But yeah, I'm proud of myself that I'm able to do that right now. The fatigue isn't as bad as it was at one point. So, I mean, only time I get really fatigued is when I think the histamines, like I get an allergic reaction to things like certain scents. I'm really allergic to certain flowers, like all these things I was never allergic to before. Yeah. But aside from that, like I feel like my only symptoms are like I have extreme heat intolerance because of my veins. It's my heart rate still goes up a bit when I stand, again from my veins. And sometimes I'll still get a little jerk like this in my body. I used to have, like, I could post a video. I have them on my phone, but I used to get horrible hand tremors. And I have some of those saved from early on, a few months after COVID. And it was like horrible, horrible hand tremors. And extreme brain fog. I would just completely forget. I look like an idiot. I would forget things. So I'm glad all that is gone. It's really now just like the heart issues. Like if I have extreme weight on my back, or I'm like moving positions, like while I'm sleeping, I will feel my heart moving, but my heart rate isn't really going up all that much, but I still feel it jerking in my chest. If anyone knows what that is, please let me know because no one can tell me. I'm still thinking it's like blood vessel inflammation, or maybe it's small fiber neuropathy that I've had goes with the off the blood vessels. If anyone has an idea, I don't know. But at least I'm able to function, you know. One thing that I still miss is being able to take a nap. I can't take a nap. I'm highly sensitive to noise, which I always was sensitive to noise because I'm a sensitive person, but like I just wake up and I cannot go back to bed. If I'm tired and I'm just starting to fall asleep and I get up, I will not be able to sleep for 6 or 7 hours. So that is something I extremely miss. Like once I know I can take a nap again whenever I want to, when I'm tired, I know I'm healing. Like you can't see it here. I wish I had my better quality, something to record this with because my phone's acting up. But I have those rashes ever since I was exposed to that heat. The rashes have come back on my nose ever since the heat exposure. So yeah, lucky me. That's something else that makes me sad when I look at my face. I'm like, I always had good skin and now I get those rashes that scab over on my nose. Like if anyone has that, please let me know. I'm curious exactly. Like I feel like what's going on in our bodies is sort of like an autoimmune thing. So yeah. So yeah, I will post an update after I try fluvoxamine. We will see. I want to have high hopes, but I'm also like, I know what my body acts like. So I'm kind of scared because I saw the side effects and I know a lot of people get bad side effects. And I know I will have issues sleeping and I like to sleep because sleep doesn't come easy. So yeah, I will post that this weekend probably. And hopefully it's a good update. I mean, even if it doesn't do anything for me, it's better than feeling awful. So we will see. But yeah, I just thought I'd post an update on where I've been and I'll post on here soon. Bye.